Welcome to the Brant Community Healthcare System and the Family Birthing Center. Every year we deliver over 1,500 babies where we support a philosophy of family-centered care.
This is supported by our 5-bed labor and delivery unit, where we also have 3 assessment rooms and an operating room. And our assessment rooms will determine whether or not you're actually in labor or address any other concerns that you may have. After you deliver, we have 14 postpartum beds, and 12 of these are private to help facilitate your family's privacy in their journey with your new baby. We also have an 8-bed special care nursery, which is also located within the Family Birthing Center should your baby require any additional or specialized care. We understand that this journey of having a baby is a very unique and special experience for your family, and our team of healthcare professionals, including the nurses and the doctors, are here to help support this journey and help you learn to care for your baby before you go home.
We want to welcome you to the Brant Community Healthcare System family and to this tour. We hope that it'll provide you with all the information that you need to support you in this unique and special journey of having a baby.
Today we will be taking you on a quick tour of our hospital. First, we'll start in labor and delivery, where you'll be giving birth to your baby, the postpartum unit, where you and your baby will stay until you go home, and the special care nursery, where your baby will go if they require special medical attention. Along the way, we will introduce you to a number of our committed and dedicated staff members, and after this tour, you should have a good idea of what to expect with your experience here. Once you arrive at the hospital, please use the entrance closest to the emergency department. If you are over 20 weeks gestation and you're here for either an assessment, labor, or a cesarean section, please go directly to labor and delivery. Do not stop at the emergency department. Once you enter the hospital, you will turn right and take this hallway down to the first bank of elevators. Take the elevators to the 3rd floor, and this will bring you directly to the Family Birthing Center. Upon your arrival, you will be greeted by a receptionist or a nurse who will require your health card, and then they will escort you into labor and delivery. If there is nobody at the desk when you arrive, if you just go around the corner to the left, there is a phone where you can pick up and they will let you into the unit. Please note that if you are seeing an obstetrician or a midwife here in Brantford, your healthcare provider has already pre-registered you here at the hospital.
Once you are inside labor and delivery, you will be assessed in one of our triage rooms. If you are here because you think you are in labor, may have broke your water, or for any other reason, one of our nursing staff will assess you. If it is determined that you are not in labor or in very early stages of labor, you may be sent home. Do not be discouraged or embarrassed, as it can be very difficult to tell the difference. If you are concerned for any reason once you go home, you are always welcome to come back to the hospital, as nursing staff and obstetricians are here 24/7. If it is determined that you are in active labor or are here for an induction, one of our nurses will escort you to one of our spacious birthing suites, where you will stay for the remainder of your labor experience until your baby is born. Labor is an emotional and joyous experience for you and your family. We encourage patients to choose 1 to 2 coaches to remain with them throughout their labor experience. Once the birth of the baby has occurred, visitors are welcome on both labor and delivery and postpartum. We do ask that visitors wait at home until the baby is born. Whether you're a patient of an obstetrician or a midwife, our family birthing team is here to support you and welcome you to our program.
A common question our patients ask us is what they need to bring with them to the hospital. For your labor experience, you really don't need many things. Some things that you can bring are your phone, a tablet, music, or anything that you would feel is necessary to make your birthing experience great. We encourage patients to not bring many items for their labor journey in order to keep the rooms as open as possible for their experience. When you arrive in your postpartum room, you can bring your personal items with you at that time.
Some clients choose midwifery care for their pregnancy, birth, and post-delivery care. As one of the midwives here at Brantford General Hospital, I provide comprehensive care for low-risk deliveries. If complications do arise, we consult with the nurses and doctors on staff to provide comprehensive and complete care. All clients who deliver here at Brantford General Hospital have different pain relief options, including using our new labor tub, sterile water injections, or nitrous oxide, also known as laughing gas. Talk to your care provider about your pain relief options.
Every patient's tolerance to pain is different, and for that reason we have a variety of pain management options available at the Brantford General Hospital. In addition to the non-pharmacologic options that have already been discussed by the midwives, we also have access to a narcotic technique, as well as epidural analgesia. An epidural is a tiny plastic catheter that is left in the lower part of your back, through which we can give you some pain medications throughout your labor. Approximately 65 to 75% of the women who deliver at the Brantford General Hospital will receive an epidural at some time during their stay here. If an epidural sounds like something you might be interested in, a member of the Department of Anesthesia would be happy to come and discuss the risks and benefits with you.
About an hour or so after you deliver your baby, you're going to be transferred from the labor room over to the postpartum unit, which is located on the same floor. Each of our postpartum rooms are comfortable and spacious and offer an area for you and your family, as well as your visitors to come visit you after your baby has been delivered. Each room has a private washroom as well as a private shower for you to use throughout your stay. Here at the Brant Community Healthcare System, we promote family-centered care and encourage your partners to stay overnight with you at the hospital. We promote zero separation between you and your newborn, therefore all care will take place in the postpartum room. There are plenty of nurses who are available to provide education and support around breastfeeding and to help you take care of yourself and your newborn. Don't hesitate to ask any questions while you're in the hospital and throughout your stay. If you have a vaginal delivery, you can expect to stay in the hospital for approximately 1 to 2 days, and if you've had a cesarean section, you will be in the hospital for about 2 to 3 days.
Over 80% of women delivering at the Brantford General Hospital deliver naturally, that is, they have vaginal deliveries, and for a variety of reasons, about 20% of women require cesarean section. This operating was dedicated to the delivery of babies by cesarean section, and working in this operating room would be the obstetrician doing the cesarean section, the anesthesiologist providing the anesthetic, and a team of highly skilled nursing staff. We're fortunate in that the operating room here for cesarean section is on the same floor and directly next door to the laboring room, so that women can be delivered by cesarean section fairly promptly if necessary. Following the cesarean section, women are taken to the post-anesthetic care unit, which is right across the hall from the operating room, where they can spend time with their newborn baby and their significant others and family members.
Items required for your postpartum experience can vary patient to patient, but generally, patients like to bring their own clothes, footwear, diapers for your baby, a breastfeeding pillow, and your car seat. The car seat is not needed until you're discharged home, so it can remain at your home until this time.